My name is Christopher Gentile. I'm one of the otolaryngologists for Northeast Atlanta, ENT, and allergy. I was born and raised in New Jersey, up on the north side, about 40 minutes away from New York City, and ended up going to Franklin and Marshall College in Lancaster, Pennsylvania, and then came back for a year for my Master's of Biomedical Science at University Medical and Dental School of New Jersey, now Rutgers. My medical degree was at Wake Forest School of Medicine at Winston-Salem, North Carolina, and then I completed my residency at University of Alabama in Birmingham. I've been living in Atlanta for about 2.5 years now. My wife is also a pediatric otolaryngologist now with Emory. I've always wanted to go into medicine. My father was an internal medicine doctor, and so I spent a lot of my vacations at his office, and I really kind of enjoyed a lot of the interaction that he had with his patients, and they had really great relationships. And so I think when I was a child, I really wanted to be a part of something like that. And then once I kind of was able to get involved in otolaryngology and ENT, I really enjoyed the breadth of the procedures. You can do procedures in 15 seconds, and they can take 15 hours, anything from an ear tube in an infant to a large-scale reconstruction for an adult. For me, it's been pretty rewarding because a lot of the patients come in with symptom-based problems a lot of times. They can't breathe, they can't hear, they're having trouble tasting. And so it gives me an opportunity to provide some sort of therapy, whether it's a medical therapy, surgical therapy, or whether it's just guidance in the office. And it kind of lays the foundation for a nice relationship with the patient over time. We are both the medical doctors and the surgeons for our patients. And so I think we provide really comprehensive care, whether it's over the phone all the way to an operating room and anywhere in between. When I'm not working, I enjoy spending time with my wife as well as our 2 dogs, Maverick and Scout, and we also have a new daughter as well who's been a welcome addition. So we like to go out and hike. We're actually running some 5Ks and 10Ks with her now in a little rolly stroller. The practice itself is on the cutting edge, a lot of new equipment, a lot of new techniques. There's a real push to remain on the cutting edge for ENT.